And today we're talking about, a patient's actual experience, her positive experience with clinical trials. So I would like to introduce, our main guest of the show today, Laurie Adami. So Laurie, thank you for joining us. Laurie is a lymphoma survivor and has participated in a few different clinical trials. So we've got some questions for her today, and I'm really hoping that this session is helpful to some of the other patients out there who may be thinking about, participating in a clinical trial or just have questions in general. So, Laurie, thank you so much for joining us.
You're welcome. Happy to be here today.
Yeah. And we also have Kristen Johnston on the line with us. She is our Chief Nursing Officer here at Massive Bio as well. Hi, Kristen.
Hi, everyone. Hello.
All right. So, Laurie, I just want to jump in and get started here. You have a really fantastic story to share, and we're, grateful that you're here taking the time with us today to talk about this. So, I guess, so my first question is, obviously you're a cancer survivor. So congratulations there. We are always happy to hear those stories. But can you tell us a little bit about your diagnosis? Did you visit your doctor because you weren't feeling well initially? Or how did that diagnosis come about?
Sure. So I was 46 years old and I had started to experience some strange new health situations. I had begun to get a lot of sinus infections. I had a swollen node in my neck. I had a very dry eye and could no longer wear my contacts. And I was like a long-term contact lens wearer. And then I had felt something in my abdomen that was suggested it was a hernia. But most of all, I was really, really fatigued. And so something just wasn't right. And so I began to see doctors to try to get to the end, figure out what was going on. Mm-hmm. And on Good Friday, 2006, I had was given a CT scan to see what was going on. And they discovered that I had a grapefruit-sized mass in my abdomen.
Wow.
And extensive disease throughout my body. So, and at that point I was sent for a biopsy. And it was determined that I had a type of non-Hodgkin lymphoma called follicular non-Hodgkin. I was stage 4 and, obviously very sick. And all of the health problems that I had been experiencing were a direct result of that non-Hodgkin lymphoma diagnosis. At the time, I was told that follicular non-Hodgkin is an incurable cancer and, was given some pretty scary statistics at the time of my diagnosis.
Yeah.
Wow, yeah. Laurie, you've really been through so much. So from there, then how did a clinical trial kind of come into play?
Yeah.
Okay. So right out of the box, at the time, there was really one approved therapy that was sort of considered the big guns, if you will. It was called R-CHOP, which was a combination of a monoclonal antibody Rituxan and 4 chemo kind of alkylating agents. And because I had such extensive disease and because I was stage 4 and because I was so sick, I was taken directly to that option as being my best shot for complete remission. So I had R-CHOP starting, just after my diagnosis, May of 2006, and underwent 6 cycles and of the therapy, every 3-week chemo. And at the end was declared in remission. And so, of course, was thrilled to hear I was in a complete remission after being so sick. But unfortunately, at my first follow-up scan, I had already relapsed. So 3 months later, I already had disease presentation in my lungs. And at that point, I was encouraged to do an auto stem cell transplant. And my cells had been harvested right after I got into complete remission. But I began to research an auto stem cell transplant for follicular non-Hodgkin. And what I discovered was that half of the patients who got a stem cell transplant at their first relapse after R-CHOP, relapsed after the stem cell transplant within the first year.
Wow.
And so I realized the odds weren't so great. And so that was when I thought, I've got to find a trial. I've got to find something else to do to buy time.
Okay. Wow. It sounds like you really did your research, which is amazing.
That's fantastic.
And so great, honestly, for everyone to know, really. But now, was your physician supportive of your decision to consider enrollment in a trial?
So I had gotten 3 opinions at the time when I was diagnosed, because it's very important for a cancer patient to get more than one opinion.
Absolutely.
And so all of them had said the same thing, R-CHOP. And at relapse, they were all saying the same thing. But because I knew the statistics were so poor, and I had a little boy in kindergarten, and honestly, to go in the hospital for 3 or 4 weeks and get the stem cell transplant with a likely not great outcome, I was just refusing to do it. And so I was actually being cared for by a gentleman who runs the stem cell transplant department at one of these outside opinions. And so, of course, he was wanting me to transplant, and I kept saying, but I can't. I've got this little kid. I can't be away. So he agreed to look into trials at his facility.
Okay.
And so that's how that all worked out. And so it was very much my being very much my own advocate, that I was just refusing to do it. And I was saying, you've got to find me something else.
Right.
Good.
So it sounds like you really, you obviously put family first, and that was a huge consideration for you. So did you discuss this decision, I'm assuming, with your family, before, and how did they feel about it?
My family was all on board. The thing was to get the odds in my favor, to do what was going to prolong my life. And I couldn't see the basis for doing a stem cell transplant and having a second round of really intense chemo that could leave me with long-term potential side effects. Now, the trial that I ended up getting offered was actually an oral treatment. It was pills. And so it meant I could even do it from home, which, compared to being in the hospital for 3 or 4 weeks and complications, I mean, it was kind of a no-brainer to try this because there was really no harm. And this trial that I got into, this drug that they were trialing for my disease, had already been approved for T-cell lymphomas. So I knew the safety profile had already been well established. So the risks were, appeared to be relatively modest compared to a stem cell transplant. And it was a phase 2 trial. So it was past that phase 1. So it was more of the dosing stage where they were determining the most effective dosing stage. So it was really not much of a choice for me to make.
Right.
That's great. That's great. Okay. So I guess my question from there is, you decided to get enrolled in the trial. How was it complicated to get enrolled? Or what did that process look like? And then once you were enrolled, how was your experience? Was the staff helpful? Did you need assistance with any additional information or travel or anything like that?
Okay, so compared to getting a stem cell transplant, it was a breeze.
Good.
And, I was assigned a trial coordinator where I was being treated in this trial. And, she immediately reached out. They had to do biopsy, which, they would have for an auto transplant as well. So they had to do a biopsy of one of the mouses. But they arranged it, everything was set up. I had this trial coordinator holding my hand the entire time. So she met with me when I went out to the facility. She guided me through everything. I signed the releases, when you go into a trial, you have to sign documentation, that you're enrolling in this, and, they outline the side effects and whatnot. And the process was laid out very clearly to me, and it was a snap. So I was able to enroll really quickly, which at that point was important because, I knew my disease was growing the longer I waited, and I wanted to get started. So, within 10 days, I had already started. It was very quick.
Sounds like they were treating you like a VIP patient.
Yeah.
I don't know.
Which you are.
Well, people that enroll in clinical trials are really treated. I was in 3 clinical trials over my 12-year battle with Non-Hodgkin. Wow. And, every time I did a trial, they do really, I felt like they were rolling out the red carpet,
Wow.
because you're valued as a participant, because without trial participants, they cannot further these new therapies. So, we're really valued, all along the way. They held my hand. I was getting called constantly. Are you okay? Are you having any new symptoms? They really watch you like a hawk, because they want to make sure that there's nothing going awry in this trial. And in fact, I had 7 therapies over my 12-year battle, and 3 of them were clinical trials. And I have to say, I felt much more cared for when I was in a trial than when I was in the standard of care.
Yeah, that's so wonderful to hear. Yeah, I mean, that's what we always promise our patients, that's the type of care they're going to get and receive, that close watch, that extra eye, an extra hand really, and ear to listen to as well, that's the extra step, and the extra, that's why we want to encourage patients as well. Just
And the fact that I ended up doing 3 clinical trials just is proof right there that the first process was so smooth for me that, there was no reason not to do it. And my perception was that clinical trials offer much more targeted therapies, so the side effect profiles for those tend to be, much more tolerable, because like on the 3 clinical trials I was on, I didn't lose my hair. I didn't, it was very different because of the fact that they tend to be much more targeted, newer technologies, newer therapies. So it was a great experience.
That's wonderful. That's wonderful to hear. Like Kristen was saying, that's what we would hope for every patient. And I really, truly do feel that, patients that are participating in these trials, especially, the focus is on that patient. It is all about that patient and how you're doing with that treatment and follow up, and just making sure that there is someone there for you and checking in on you all the time. So it's a benefit for the patient, as well as the research team, and just, cancer research in general. So I love hearing that, you did choose to participate in 3 different trials. Clearly you recognize, the importance there, and the treatment options that are available to you. So, what would you say to someone who's unsure right now about participating in a trial? Maybe talk to us a little bit about what your fears were before your first trial, and then some advice that you could give anyone watching that may be interested in hearing about a trial.
So honestly, the main fear I had going in was that it might not work, that it might not control my cancer. So, and then I was looking at the potential of, what else am I going to do? Because remember, at the time I got into the trial, the only other option was a stem cell transplant. And for me, going into a trial, I was hoping to at least get stable disease, because if I could get stable disease, that would buy time for other options to come down the pike. I read the disclosures, I read the side effect profiles, and honestly, they looked significantly better than the side effect profiles and the other option I was getting, which was an auto stem cell transplant. So, the risk on that side and the concern in my mind was much less with the trial options than it was with the standard of care therapy.
Yeah.
So honestly, that was not a concern. It was much more, is it going to work? Is it going to buy me time? Because honestly, I was trying to buy time, waiting for other therapies to come back that could be, or to come out, that could be more effective at controlling my disease.
Yeah. So it sounds like even when, before you even enrolled to the trial, you were incredibly informed about, even what we know so far as the potential side effects. Like, you had all the information that you needed to make that decision to actually get enrolled, right?
Right. It was very clear, and they had extensive data. They, when they get into these trials, they typically have enough vetting that they can establish what the likely side effect profiles will be for the patient. Now,
Right.
of course, when you're on a trial, you have to report anything that happens to you. So, you develop a headache, you have to communicate that. And, that headache could have nothing to do with the trial, but when you're on the trial, you report everything that happens to you, which means the side effects can include a lot of stuff that may never happen to anybody, because, there's also people in the trials that have other pre-existing conditions.
Right.
And so they might be having side effects that you'll never see, but everything's out there for the patient who enrolls in the trial to take a look at it. So, so it was never, everything was very, very transparent. Everything was presented in a way that was, very, very transparent. So.
Okay.
That's
Now,
fantastic.
Laurie, I know you mentioned you were in 3 trials. Is that correct?
That's correct.
Now, can you tell us what phase trials you were involved in?
Sure. So my first trial was a phase 2. That was the one I got into in 2008. That was a phase 2 trial. And then that held me stable for a year, which was great. It bought me a year. And then by then, a couple other things had been approved. So I was able to get approved therapies for therapy 3 and therapy 4. So I was what they consider a frequent relapser. At that point, after my 4th relapse, I was looking for a 5th treatment and ended up enrolling at that point in a phase 1 trial.
Okay.
So that was of a PI3 kinase inhibitor, so very targeted small molecule drug. And I actually lucked into the slot. I got the last slot. I got the 20th position at UCLA of this phase 1 trial.
Wow.
So clearly a phase 1 trial is different. It's earlier in the process,
Right.
but that drug actually bought me an incredible amount of time. That was also an oral drug. So many of these trials are oral drugs, so that you go in and they give you pills and you take your pills home. And the other beauty I should mention of trials, which I didn't mention earlier, is that trials are provided free of cost to the patient. So at least in my condition, for the 3 trials I had, I never had any out-of-pocket expense for anything, even managing side effects. It was all covered by the trial. So not only do they roll the red carpet out and husband you through the process, but you don't get any bills for any of the treatment, which, for many people is a very large consideration.
Right.
So my second trial of the PI3 kinase inhibitor, which is now called Zidelig, was a phase 1 trial. And then, I started on that in the spring of 2011. And I was actually on that drug until the end of 2016.
Wow.
And I continued to take it orally. It never put me in complete remission, but I had stable disease. And in 2012, I heard about this amazing new thing called CAR-T, which is chimeric antigen receptor T-cell therapy. And with CAR-T, they actually take the patient's own immune system, part of the patient's own immune system, my T-cells, and they genetically modify it in the lab, and they return it to the patient and it's very targeted to kill the cancer.
Yeah.
So I had heard about this in 2012 while I was still in my phase 1 study, and I called my oncologist the next day and I said, when is this coming? This is amazing. He said, you're going to have to be patient because they're using it first for aggressive lymphomas and aggressive leukemias and pediatric leukemia patients. So it's going to be several years, but you're doing great on Zidelig. We're going to carry you along as that, keeps working. You're going to stay on that because you have stable disease. And so my third trial in 2018 was a phase 2 trial of CAR-T for follicular non-Hodgkin's patients.
Amazing.
Great.
So I was actually the first patient at UCLA for CAR T for follicular non-Hodgkin's. Yep.
Wow.
Amazing. So then, Laurie, tell us, what's the $1 million question that everybody wants to know? What was the outcome?
The outcome, for the first time in 12 years, my 7th therapy finally put me in complete remission.
Wow.
Amazing.
And I wish we could put up on the screen my before and after scan.
Yeah.
And we might want to do that after the fact, because you will look at my PET scan before I got CAR T and my body was riddled with tumors. I probably had my oncologist estimated I had 8 pounds of tumor burden when I got my CAR T cells back. And the beauty of CAR T is it's a one and done. It's not like a chemo, which you get maybe 6 months of chemo, or, I was on the trial for almost 6 years, my second trial, which kept me stable. But CAR T, you get it and then you're done. Yeah. And I don't have any long-term side effects. And a month after I got my CAR T cells, they took me in for a PET scan and my disease was completely gone.
Wow.
You're bringing me to tears. That's amazing. I love that.
And,
that is,
after having a 12-year battle to finally get a remission,
I can't imagine the feeling. I truly, truly cannot.
Yeah.
But we're so happy for you and so excited that you can be here to tell us your story, and I'm sure anybody who's listening is also feeling the same way and feeling the same joy for you.
Yeah.
So,
my son was in kindergarten when I was diagnosed, and he spent his entire elementary, middle, high school with a mom sick in treatment with cancer. And the day after I got out of getting my CAR T in the hospital, he actually left for his freshman year of college in Washington, D.C. So finally now, 2.5 years later, I am still cancer-free and in complete remission.
Amazing. Absolutely amazing. And now you can enjoy everything and hopefully not have that extra weight on your shoulder or in your body, that extra 8 pounds. Right?
Exactly.
So, what are some tips that you would give patients who are considering clinical trials right now, and they're either scared or hesitant? Is there anything that you want to share?
So one thing I want to share is that, oftentimes a patient will see an oncologist who may have been practicing for a decade, 2 decades, 3 decades, and they may not know about clinical trials. So it's really incumbent on the patient to begin to explore finding a clinical trial. Now, if you live in a place like Los Angeles, California, where I live, we have 6 huge cancer treatment centers in LA alone. And in the surrounding area, we have 10, So I had great exposure and I could make appointments to go see these doctors that were offering these trials. Although now telehealth is a possibility. Yeah. So patients can actually get on through Zoom or some other mechanism and have a consult, with an oncologist who's offering clinical trials. Yeah. So if you're not hearing about it from your current physician, then it's really incumbent to try to find, other doctors that you can speak to remotely about the possibilities. And, an important thing for a patient to understand, like I was in LA, so I didn't have to get travel costs covered. But oftentimes on a clinical trial, the facility offering the clinical trial will pay for your travel. They'll pay to put you up to enroll a clinical trial. And so they will really go out of their way to accommodate to get a patient into a clinical trial.
Yeah, right. Yeah.
So,
yeah, we definitely see that a lot with some of the sites that we're interacting with as well. So I'm glad you mentioned that, Laurie. And that's something else, something else that you mentioned is taking the time to research this as a patient and finding those trials. And I think that's where Massive Bio can help as well in taking a little bit of that work off of the patient to try to find a trial, as well as the patient's provider. If the provider's looking for another option for the patient, that's where our services can step in and sort of ease that process. And you're right, you're in an area where you have a lot of resources there for you, but in a lot of other places throughout the country, it's difficult to really get started, and where do you even look? So I'm grateful that you have been in touch with Massive Bio and are willing to share this with us as well, and I hopefully this can help other patients, make that decision to get enrolled in the trial. And yeah, we can absolutely help there.
Right. And I also want to add, the pace of change. So when I started with cancer in 2006, there really weren't the options that there are today. And the acceleration in rolling out trials and approving new agents compared to where I was 15 years ago, it's like night and day. So, the whole environment has changed. And so patients need to take advantage of that. And as I said earlier, these treatments tend to be much more targeted, these newer therapies, typically fewer side effects, much better understood side effects. And, I went through 3 clinical trials. I went through 7 therapies. And, I'm 61 now. I was diagnosed at 46. And, I'm training actually to go to the Mount Everest Base Camp to raise money for more cancer research.
Wow, that's fantastic.
And so I'm getting strong. And, the fact that I can do that now after having gone through all this cancer treatment really is pretpretty incredible. So it just really speaks to, the fact that clinical trials aren't it's not like 30 years ago, it was much less understood, or even 20 years ago.
Yeah.
So I'm a big proponent of trials, because they saved my life. I wouldn't be here if I hadn't been able to get into those trials and get into a complete remission with a phase 2 study.